Welcome to the Module 10, Radiology Information Systems and Picture Archival and Communication Systems Workflow, their communication and sequence. Once again, the video is only for information and you have to check the local laws and regulations before performing some action. The workflow is different in each hospital, in each healthcare facility, and of course the methods are somehow different, but anyway, their structure is quite similar. In most of the hospitals, there is a workflow that starts with the patient admissions, then the patient is examined by a physician. The physician may send the patient to the radiology for some imaging and may send not, but in our case, the patient goes to the radiology. Then, when the imaging is ready, the patient returns to the physician. The physician makes some treatment or prescribes some treatment, and when the patient is healthy, is being discharged from the hospital. So the patient goes to the hospital, the data are recorded, and each patient has the so-called master patient index. We spoke about this already. And for the patient who is sent to the radiology department, the data for this patient are sent from the hospital information system to the radiology information system along with the modality, the protocol, the referring physician, and so on. Then the radiology information system schedules the exam, assigns the accession number. We spoke about this. The accession number is unique for the. And then the radiology information system prepares the so-called DICOM modality worklist with all this data. And for example, the radiology information system sent information that some patient will be available next day at 13:00 for CT exam and send this information to everyone. The picture archiving and communication systems receives this message, and CT in our exam also accepts this message because the patient is scheduled for the computed tomography. But for example, the MRI and the X-ray, they do not accept this message because the message is not intended to them. The modality work list contains a lot of data. I said already the patient name, the birth date, the age, the ID, the modality, the protocol, so the given device has all needed data. The advantage is that the technologists do not need to enter the data again and again, and this means less errors. So the technologists just check that the proper patient is at the proper device, check this information, of course. They may correct some information. After the image is ready, the technologists perform quality control on the images and then they are sent to the main server. In the meantime, the radiology information system requests information from the picture archiving and communication system about the study, and once the study is ready, the picture archiving and communication system provides a link to the images to the radiology information system that may provide this link to the hospital information system, for example. Also, sometimes there are patients that have previous images, and the physician needs to check how the patient status is going, if the patient is getting better or worse, to compare this study with the previous study. So, for example, the radiology information system sends message to the picture archiving and communication systems that need the old images of the patient. So the picture archiving and communication system checks the archive and provides these images also. And one very important parameter in the system is the retrieval time, and we are speaking about seconds. We are not speaking about days or hours, we are speaking about seconds. So the old images can be requested after the new images or ready, or even before the new images are ready. So the radiologist will have the old images and the new images at the same time. Of course, if they are relevant to the exam. If the new exam is CT of the abdomen, while the previous was MRI of the head, of course they are not related. But if they are related, this can be given to the radiologist at once. Then, once the radiologist reads the images and prepares the report is stored in the radiology information system. The referring physician may look at the report and eventually the images if the report is not clear or if requires some additional information. And the images can also be given to the patient. They are sent to a burner, a DVD or a CD burner to be burned on a disk and given to the patient because the patient may need to go to other facility in order to be checked or just to have information for further situations. And after some time, the images are stored to the archive server. They spend certain time on the main server. It depends, of course, on the preferences of the healthcare organization and the settings they put. But the normal time is 2 weeks or 1 month. This is the normal time to spend on the main server and then to go to the archive. And the radiology information system and the picture recovery and communication systems work together, but in order to work together, of course, they need to communicate each other with this information, the image-related information and the images. But the main problem is that they do not speak the same language. The picture archive and communication system use DICOM file format. DICOM is abbreviation for digital imaging and communication in medicine. Radiology information system use HL7 file format. This is abbreviation for health level 7. So imagine some conversation between them with different languages. They will just not understand each other. So they need someone to help them to understand, and they may use a broker or a brokerless connection. And the broker is a part of a code that translates this information. The radiology information system sends some message to the broker using HL7. The broker converts to DICOM and sends to the picture archiving and communication system. And the information from the picture archiving and communication system in DICOM is transferred by the broker to HL7 and sent to the radiology information system. Of course, there are some systems that are brokerless, but you have to be very careful if one system is really brokerless or if it is with an internal broker, because there are some manufacturers that in order to facilitate the communication, they build such brokers, for example, in the picture archiving and communication system model. In this case, you do not need broker, but the connection is not brokerless. And of course, there are some connections that are really brokerless, that communicates directly between the radiology information system and the picture archiving and communication system. Thank you very much.